what do you see for the future of this? Is this going to just be standard in all hospitals, or?
Well, I'd like to think it becomes the standard, and I think the hospitals that are using it would like to think so. Most of the hospital systems that use this are very high quality institutions, and we know that because there's a large number of them that perform much better than the national benchmark. The future is improvement in the technology. I think when we started in 2006, for example, the camera systems were one-way systems. We could see the patient and we could talk to the patient, but they couldn't see us. So we started initially with two-way systems. Came along a couple of years later. That's much more conversational. The patient in the bed can actually see the doctor and see the nurse that they're talking to and have a better understanding of what's going on. They actually establish a little bit of a cordial relationship when they're talking to them. We try to do that. We also have more advanced type analytics coming along, better models to predict who's trending in the wrong direction and who needs intervention quicker.
So can the patient also call the lifeguard station, as we call it, and go, hey, I have a question. Do they have a button, or how does that work?
There is a button in each room, but it's not one that the patient accesses. It's mounted on the wall, and the nurse or the respiratory therapist, if they want to call the EICU and ask for help, can push the button and it rings to us, and we'll come on the camera usually in 30 seconds to a minute or so. Sometimes we'll converse with the patient if they'll have specific questions. Usually the patient isn't that interested in questioning the EICU nurse or physician. They are most often questioning their own bedside nurse, and if there's a question they can't answer, sometimes we'll come on and assist with that.